Namaste and welcome to everyone on Zoom and Facebook for joining today's COVID-19 awareness session. We have Dr. Arun Sinha with us today and Dr. Ajay Shah, who will be talking through different variants of and vaccinations. Thereafter will be question and answer session. You can post your questions on chat or comment on Facebook. Dr. Sinha and Dr. Shah will not be able to answer any specific personal related health concerns. Now, Dr. Arun Sinha is a consultant ENT surgeon at City and Sandwell Hospitals, NHS Trust Birmingham. He has been seen COVID closely while coming into contact with patients every day and wants to share the awareness with us today, which is very important. He's also a secretary for Sri Gita Bhavan, Birmingham. I will now hand you over to Dr. Sinha for his presentation. Thank you.
Hello, namaste. Can you hear me?
Yes.
Okay. I just have to. मेरी कोशिश है कि इस प्रोग्राम को मैं हिंदी में करूं, क्योंकि हिंदी हमारी मातृभाषा है. ये प्रोग्राम पहले भी हुई है और अन्य भाषाओं में. जहाँ मुझे मालूम है ये गुजराती में हुई है, पंजाबी में भी शायद हुई है या होने वाली है. और तो ये मेरे लिए ये एक अपॉर्चुनिटी आया कि मैं इसके बारे में हिंदी में, जो लोग ज़्यादा हिंदी बात करना या कोई बात समझना चाहते हैं उनके लिए ज़्यादा कंफर्टेबल इजी है, तो उनके लिए उनके नीड्स को एड्रेस करने के लिए मेरी ये कोशिश रहेगी. ये जो महामारी है, इस प्रेजेंटेशन में मैं क्या बात करना जा रहा हूं आप लोगों से, वो है इस वायरस के बारे में. ये वायरस क्या है, ये कहां से आया, कैसे हम लोगों को आज अफेक्ट कर रहा है, इसका इफेक्ट ये कैसे हमारे शरीर में आता है, इसका हमारे शरीर में इसका क्या असर होता है, और सबसे ज्यादा जरूरी कि हम इससे कैसे बचें, खुद को कैसे बचाएं और जो हमारे आसपास के लोग हैं उनको कैसे बचाएं, इसके बारे में मैं आपको जानकारी देने का प्रयास कर रहा हूं. मैं अपने प्रोफेशन से मैं ईएनटी सर्जन हूं, लेकिन यस हम लोग आज मैं उस स्पेशलिटी में काम करता हूं जहां मैं एक मरीजों से क्लोज कांटेक्ट में आता हूं. और जैसे कि आप सबों को जानकारी होगी, ये जो वायरस है ये अपने एयर से कांटेक्ट, एयर के हवा के माध्यम से आता है, जो कि हमारे नाक से, हमारे मुंह से मैक्सिमम इसके स्प्रेड होती है. इसलिए हम लोग इसको, हम अपने इस इलाके, मेरे एरिया में इसको पेशेंट्स हम क्योंकि क्लोज आते हैं तो हमें इसके लिए प्रिकॉशन लेनी पड़ी. और इस दौरान जो मैंने देखा कि इसका क्या इम्पोर्टेंस है इससे बचना, इसलिए मैंने सोचा कि मैं अपना एक्सपीरियंस को माध्यम रखते हुए मैं आपसे शेयर करूंगा कि कैसे आप इससे बचें. तो मैं स्टार्ट करता हूं कि आखिर ये वायरस क्या है. हम लोग सुना है इसके जो रिलेटेड टर्म्स हैं वो जो आती हैं, कोविड-19 आती है, कोरोना वायरस आती है. तो आखिर कोविड क्या है? इट इज कोविड-19 शॉर्ट फॉर्म है फॉर CO इज कोरोना, VI इज फॉर वायरस एंड D इज फॉर डिजीज एंड 19 इज द ईयर. 2019 में ये सामने आया. 2019 के दिसंबर में एक चाइना के वुहान शहर में एक काफी सारे क्लस्टर ऑफ केसेस हुए जहां लोगों को वायरस की न्यूमोनिया हुई. और उस वायरस को जब आइसोलेट किया गया तो मालूम देखा गया कि ये एक खास वायरस है जिसका के नाम बोलते हैं सार्स वायरस, SARS, सार्स वायरस. तो इसलिए इसका नाम पड़ा कोरोना वायरस. जो कोरोना मतलब होता है कि क्राउन, जो कि मुकुट होता है किसी राजा का, क्योंकि उसके बारे में बात करूंगा कि जो वायरस का जो शेप है वो उस मुकुट के जैसे, क्राउन के जैसा लगता है, इसलिए नाम उसका कोरोना भी पड़ गया. लेकिन वो एक्चुअली एब्रिविएशन है, शॉर्ट फॉर्म है कोविड-19 इस कंडीशन का. ये जो वायरस है ये कोई नया वायरस नहीं है. ये वायरस सदियों से, मिलियंस ऑफ ईयर्स से चला आ रहा है, लेकिन ये अभी तक सिर्फ जानवरों में पाया जाता था। तो ये कभी कभी जानवरों से निकल करके ह्यूमन में आया है। जैसा एग्जांपल होता है, लास्ट टाइम जो आया था वो 2003 में आया था, सार्स वैक्सीन के नाम से आया था, SARS वैक्सीन। वो भी चाइना में शुरू हुई थी, और वो जिस जानवरों में जो था वो ज्यादातर देखा गया था, वहां एक जो बैट जो होता है जानवर, जो कि एक जानवर मतलब कि वो एक देखने में बर्ड होता है, लेकिन वो है मैमल, जो कि रात में निकलता है, दिन में सोता है। उसके बारे में ये जानकारी हम लोगों को है। उस वायरस से वो ह्यूमन चेन में आया, लेकिन उस वक्त वो कम ही लोगों को इफेक्ट हुआ था। वो उस वायरस का जैसा नेचर था वो ज्यादा फैला नहीं, और लेकिन उसमें ये अपॉर्चुनिटी मिली कि उसके बारे में उसको आइडेंटिफाई, उसकी पहचान हुई और उसका वैक्सीन बना। उसका वैक्सीन समझिए कि 2003 से काम शुरू हुआ था, और सार्स का वैक्सीन कहीं ये सब लोग जानते थे कि ये चीज फिर से दोबारा आ सकता है। तो सार्स वैक्सीन की जो डिटेल ट्रायल होती है, तैयारी होती है, डिफरेंट स्टेजेस होते हैं, वो सब की गई। इसलिए उसका वो उसकी जो वैक्सीन जो बनी वो ऑलरेडी बनी हुई थी, वो रेडी था, उस वायरस के बारे में जानकारी थी। इसलिए बहुत लोग समझते हैं कि भाई इतना जल्दी ये नया वायरस वायरस के लिए ये नया वैक्सीन कैसे बन गया, कि ये इज इट सेफ। ये नेचुरल क्वेश्चन था, लेकिन ये इसलिए था क्योंकि ये जो नया वायरस है ये उस सार्स वायरस से थोड़ा सा डिफरेंट है, इसलिए इसका नाम सार्स कोविड-2 होगा। नंबर सेकंड वैरायटी ऑफ सार्स है, इसलिए इसलिए इसका आज हम इसको कोरोना से जानते हैं, लेकिन ये है उसी फैमिली का, जो कि पहले एनिमल्स में था और इस बार फिर एनिमल से निकल के इंसानों में आया है। तो इसके बारे में ये जो वायरस है, इसको जो सार्स वायरस है उसके बारे में खाली जानकारी के लिए वो भी एक एब्रिविएशन है कि सिवियर, SARS इज सिवियर एक्यूट रेस्पिरेटरी डिस्ट्रेस सिंड्रोम, इसलिए सार्स वैक्सीन इसको बोलते हैं, इन शॉर्ट सार्स वायरस बोलते हैं। तो डिजीज का नाम है कोविड, या हम लोग इन शॉर्ट ले टर्म में बोलते हैं कोरोना वायरस हो गई, लेकिन वायरस जो है वो सार्स CoV-2 वायरस है। जो कि इसकी खास बात क्या है कि ये पिछले वायरस सार्स वायरस से डिफरेंट ये है कि ये बहुत जल्दी ट्रांसमिट होता है, बहुत इजीली आदमी से आदमी में ट्रांसमिट हो रहा है। इसलिए पूरे दुनिया में आज इतना बड़ा ये इसकी इफेक्ट हुई है। इसका कितना ये जो महामारी है ये कितना ज्यादा इंपॉर्टेंट है, कितना ज्यादा इसका महत्व है, या कितना जानलेवा है, इसका अंदाज आप इस बात से लगा सकते हैं कि जो पिछला सेकेंड वर्ल्ड वॉर हुआ था उसमें 2-3 साल के जो भी एग्जैक्ट पीरियड था, उस जितने साल वो वॉर चली थी उसमें सिर्फ 75 मिलियन लोग मरे थे, और इस वायरस में पिछले एक साल में 125 मिलियन लोग ऑलरेडी मर चुके हैं, और रोज जो नंबर्स अभी बढ़ ही रही हैं। इसलिए ये दैट गोज टू शो कि ये वायरस कितना ज्यादा डेंजरस है, कितना ज्यादा हमारे लिए खतरा है इससे, और कितना इंपॉर्टेंट है कि हम इससे बचें। तो इसमें और दूसरी बात है कि इसके बारे में हमारे शरीर में, क्योंकि ये नया वायरस है, तो हमारे बॉडी में जो डिफेंस सिस्टम है, हमारा जो इम्यूनिटी है, वो इसके लिए तैयार नहीं था। इसलिए जो हम इसका असर हम पर होने का ज्यादा इफेक्ट होता है। ये वायरस के मैं एक और थोड़ा सा इंफॉर्मेशन और यही दे रहा हूँ, क्योंकि ये लेट और इसकी डिटेल में बता नहीं सकता हूँ ज्यादा, क्योंकि इसकी जानकारी मुझे खुद ज्यादा नहीं है। लेकिन जो समझने वाली बात यह है कि ये जो वायरस होता है ये बहुत ही छोटा वायरस, बहुत ही मामूली वायरस जो होता है, ये कितना छोटा होता है ये समझ लीजिए कि कोई एक पिन होता है, पिन का जो हेड होता है उस वेट को अगर आप कंपेयर करें पिन हेड में कितनी वायरस होगी, उस साइज के वायरस पिन हेड में देयर आर 500 मिलियन सार्स वायरस। इतना ही समझ लीजिए कितना छोटा वायरस है ये। और हमारी टेक्नोलॉजी ऐसी है कि वो एक इंडिविजुअल वायरस का शेप और कॉन्फ़िगरेशन क्या है वो आप इसमें देख सकते हैं कि इसका एक बॉल है जिसके अंदर उसकी जो मटेरियल उसको बोलते हैं आरएनए वायरस, जो होते हैं मटेरियल जो उसका इंफॉर्मेशन रखता है, और उसके दीवार में उसके जो लाल लाल आपको दिख रहे हैं ये जो स्पाइक्स हैं, ये स्पाइक्स हैं प्रोटीन्स की, जो कि और ये यही हैं जो कि जो बॉडी में आती है, तो ये जाकर के हमारे बॉडी के शरीर के उस पर्टिकुलर एरिया के बॉडी के सेल में उस स्पाइक के चलते वो चिपकती है, और उसका वहां वो ब्रेक करता है और वो बॉडी के वो सेल के अंदर घुस जाती है। एक बार वो सेल के अंदर चली गई तब ये डिवाइड करने लगती है, बहुत एग्रेसिवली, बहुत ज्यादा तेजी से ये डिवाइड करती है, और हमारे उस बॉडी का जो नॉर्मल काम था उसको वो नष्ट कर देती है। और उसके बाद ये उस डिपेंड करता है, और क्योंकि ये नाक से आता है तो ज्यादा इसका इफेक्ट चेस्ट पे होता है, इसके लंग्स में ज्यादा इसका इफेक्ट होती है लोगों को। उसके चलते खांसी होना, बुखार होना, उसके बाद ब्रेथलेस होना या उसका निमोनिया होना, ये सब बातें ज्यादा चेस्ट पे होती हैं। वरना बाकी शरीर और जगह भी वो वायरस है बॉडी में, लेकिन इसका असर ज्यादा हमारे ये चेस्ट पे इसका असर होता है। तो यही समझने की बात है कि जो इसका जो शेप ऐसा है, इसकी बनावट ऐसी है कि ये जो प्रोटीन मॉलिक्यूल्स हैं, इसका इंपॉर्टेंस ये हो जाती है, जो लाल आपको दिख रहा है स्पाइक्स, ये स्पाइक के जो प्रोटीन है, इसी को हमारे जो वायरस बनी है वो इस वायरस इसको प्रोटीन को आइडेंटिफाई करती हैं और इसको बाद उसको मारती हैं, ताकि वो प्रोटीन ब्रेक डाउन कर जाए, ताकि वो सेल में एंटर ही नहीं करता है। हालांकि कुछ और वैक्सीन ऐसी जो बनी है जो कि अंदर इसके अंदर वाली जो मात्रा, उसके अंदर की जो मटेरियल जो आरएनए है उसके अगेंस्ट काम करती है। तो डिफरेंट टाइप्स ऑफ वैक्सीन बनी है जो कि डिफरेंट वायरस के डिफरेंट पार्ट्स पर वो काम करती हैं। तो उसके बारे में हम लोग बात में जिक्र करेंगे, लेकिन खाली इतनी ब्रॉड में आपको इन्फॉर्मेशन दे रहा हूं कि ये वायरस क्या है और इसके बारे में और क्या कर सकते हैं। ये जो वायरस, थोड़ी सी और बातें बता देता हूँ रेलेवेंट, जो कि आम आदमी की जानकारी के लिए, कि ये इसके सात तरह की अलग अलग वैरायटीज हैं। और ये जो एक बार अंदर घुस जाती है तो ये डिवाइड करते जाती है, और क्योंकि ये इतनी ज्यादा जल्दी डिवाइड करती है, तो इसका जो प्रोटीन स्ट्रक्चर है, उसकी जो कॉम्बिनेशंस हैं वो चेंज करती हैं, इसलिए वो उसमें समय लगता है। लेकिन ऑलरेडी ये 1 साल के पीरियड में ये 2-3 जगह ऑलरेडी इसकी वेरिएशंस दिखने लग गई हैं। जैसे पहली बार शुरू हुआ कि ब्राजील में इसकी जो स्टडी हो रही थी, देखा गया कि ये जो बाकी देशों की जो वायरस है, कोरोना वायरस, ये ब्राजील में ऑलरेडी ये जो वायरस अब जो मिल रहा है वो थोड़ी चेंज कर गई है। उसके बाद यूके में देखा गया, साउथ ईस्ट यूके में, मुझे एग्जैक्ट शहर का नहीं मालूम है, जहां पर वहां भी देखा गया कि ये थोड़ा सा डिफरेंट है। और वैसे ही साउथ अफ्रीकन वैरायटी आई, जो कि उसका भी जो प्रोटीन स्ट्रक्चर, स्पाइक का जो दिखाया मैंने आपको बताया, उसका जो कॉम्बिनेशन ऑफ प्रोटीन्स है वो थोड़ी डिफरेंट है। तो अभी तक देखा यही जा रहा है कि जो हमारी वैक्सीन अभी अवेलेबल हैं वो इस वेरिएंट के आमतौर पे वो इन वेरिएंट के से भी एक्टिव, उनके अगेंस्ट एक्टिव हैं, या हो सकता है उसकी जानकारी अभी पूरी बाकी नहीं है। वो जानकारी अभी आ रही है कि वो क्या, और हमें ये वैक्सीन को कुछ और चेंज करना पड़ेगा ताकि ये इनके अगेंस्ट और काम करे। लेकिन इंपॉर्टेंट बात ये है कि अभी तक ये 2-3 जो नाम बताए मैंने, ये अभी तक आइडेंटिफाई हुई हैं, लेकिन जो ये जिस तरह से ये वायरस चेंज करता है, ये इस मैटर ऑफ टाइम की इसकी और भी वैरायटीज हो सकती हैं, आगे होंगी, या कई सालों के बाद दूसरी वैरायटीज फिर आ सकती हैं। यही इसका चैलेंज है, यही इसकी प्रॉब्लम है, क्योंकि ये चेंज, इसमें जो चेंज आ रहा है। तो देखा जाए, आगे बढ़ते हैं हम लोग कि आखिर इस वायरस से होता क्या है। आमतौर पे ये वायरस जो है आम आदमी को, क्योंकि ये जैसे बताया कि बहुत कॉमन लोगों को अफेक्ट कर गया है, लेकिन मोस्ट पीपल को, जो हेल्दी इंडिविजुअल्स हैं, उनको ये 80% लोगों को ये ज्यादा तकलीफ नहीं करती। उसमें लगता है ये नॉर्मल कोल्ड वायरस है। एक्चुअली दिस इज अ टाइप ऑफ कोल्ड वायरस, जो कि हमें सर्दी जुकाम लगती है, जो 3 दिन में 4 दिन में ठीक हो जाता है, ये उसी फैमिली का ही वायरस है। लेकिन इसकी अपनी कुछ खास बातें ऐसी हैं कि ये ज्यादा जानलेवा, ज्यादा खतरनाक है। तो जो उसकी कॉमन सिम्टम्स जो आती है कि अचानक किसी को हाई टेम्परेचर होना, जिसपे कि आपका सर गर्म, बॉडी गर्म हो गया, या आपको नया तरह का खांसी होना शुरू हो गया, ज्यादा कस का, थोड़ा सा डिफरेंट खांसी है जो कि ज्यादा है, पिछले 24 घंटों में 3 बार आपको बहुत ज्यादा आपको खांसी की एपिसोड्स आई हैं। और या नहीं तो फिर आपका सेंस ऑफ स्मेल या टेस्ट आपका अचानक चेंज हो गया या रुक गया, आपको कोई चीज की स्मेल नहीं मिल रही है। ये सब लक्षण हैं कि आपको शायद है कि आपके बॉडी में ये वायरस आ गई है। इसका मतलब कि आप इसको बात को समझें और इसका आप प्रिकॉशन लें, ताकि आप अपने आप को आइसोलेट करें, अपना टेस्ट कराएं कि कंफर्म करें कि आपको है या नहीं है, और अपना आइसोलेट करें, अपने आप को किसी और से आप नहीं मिलें, ताकि ये आगे बढ़े नहीं। तो आमतौर पे जैसे बताया कि 80% लोगों को ये इसी स्टेज पर रह करके वो ठीक हो जाता है। लेकिन चक्कर क्या है कि 20% लोगों में ये ज्यादा सीरियस डिजीज होती है। उस 20% लोगों में करीब करीब 15% लोगों में जिनको में सीवियर केसेस होती है, कि उनको सीवियर चीज मतलब क्या होता है कि उनको अचानक उनकी सांस लेने में दिक्कत होने आने शुरू आती है, क्योंकि वो वायरस उनके लंग्स में जकड़ गई होती है, तो उनको सांस लेने में दिक्कत होने शुरू आती है, उनको छाती में दर्द होना या प्रेशर सेंसेशन होना लगता है, उनका टेम्परेचर बहुत ज्यादा बढ़ जाता है, उनके दिमाग पर असर होने लगता है, वो कंफ्यूज लगते हैं, वो बीमार लगते हैं, देखने से कोई आम आदमी लगेगा कि भाई इनकी तबीयत बहुत खराब है। तो ये सीवियर कैटेगरी के होते हैं। इस सीवियर कैटेगरी की जो लोग होते हैं, इसमें से भी समझिए कि जो 20% लोग जो हुए, 15% लोग इस कैटेगरी के में आने के बाद भी जो हॉस्पिटलाइज होते हैं, तो इनके ट्रीटमेंट से ये ठीक हो जाते हैं। लेकिन प्रॉब्लम क्या है कि बाकी 5% लोग जो इस सीवियर कैटेगरी में हैं, वो इसके शिकार बनते हैं, इससे डेथ हो सकती है। तो इसलिए ये बहुत सीरियस डिजीज है। आप ये समझिए कि आम सर्दी जुकाम से कभी किसी से डेथ नहीं होती है। हम लोग जो फ्लू जानते हैं, फ्लू वैक्सीन हर साल लेते हैं, इसी फैमिली का वायरस है, क्योंकि वो हर साल बदल रहा है, इसलिए हर साल आपको नया वैक्सीन बनता है और बोला जाता है कि हर साल आप वैक्सीन लीजिए। और इसलिए उसमें वो चीज आप, उसमें भी न्यूमोनिया भी हो सकती है फ्लू से, उसमें भी कुछ लोग मरते हैं, लेकिन उसकी नंबर संख्या बहुत कम है। अनलाइक ये, क्योंकि आप जैसा मैंने बताया कि इतने बड़े पैमाने पर इतने करोड़ों लोग इफेक्ट हुए हैं, उसमें अगर 5% लोग मर रहे हैं, तो ये बहुत ही बड़ा नंबर है। ये दिखाता है ये कितना सीरियस कंडीशन है ये। इसलिए इंपॉर्टेंस है कि हम इससे कैसे बचें, औरों को कैसे बचाएं। इसलिए सबसे बड़ा इंपॉर्टेंट जो चीज होती है कि ठीक है, हम जान गए कि हमें क्या होती है, अगर हम कैसे जाने कि हमें हो गई है या हो गई है, तो हम क्या उसकी बात करें। हमें हमारी इंडिविजुअल, हम हर इंसान की क्या रिस्पॉन्सिबिलिटी है कि हम कैसे लोग औरों से दूरी बनाएं ताकि ये वायरस किसी और को नहीं पकड़े। इसको बोलते हैं सोशल डिस्टेंसिंग। ये वर्ड हमेशा हर जगह दिखी आती है कि सोशल डिस्टेंसिंग करिए, ताकि आप औरों को नहीं फैलाएं। आप ये मान के चलिए कि आज के दिन में कहा जा रहा है कि हर तीसरा आदमी बाहर में जो घूम रहा है, उसको वो वायरस कैरियर है। इसका मतलब कितना आपको नहीं मालूम है वो कौन है। आपके अपने परिवार के लोग हो सकते हैं, आप रोड पे आप दुकान में जाते हैं, आप रोड पे चल रहे हैं, आप कहीं भी किसी लोगों से कांटेक्ट में आ रहे हैं, तो आप अगर, इसलिए कहा जाता है कि आप दूरी मेंटेन कीजिए, कि आप कि कम से कम आप 6 फीट या 2 मीटर डिस्टेंस मेंटेन कीजिए, ताकि उसके पास वायरस है भी तो आपके पास नहीं आए। तो और हम दूसरी बात मैं इसके बारे में बताना चाहता हूँ सोशल डिस्टेंसिंग में लेकर के, कि इसकी जो वैक्सीन भी जो बनी है, या हमें जो आज इतने लोगों को वैक्सीनेशन हो गई है, तो वैक्सीन होने के बाद भी ये वायरस आपके बॉडी में, आपके नाक में, आपके बॉडी में आ सकती है। लेकिन आपको, अब आप ज्यादा प्रोटेक्टेड हैं, आपका बॉडी शरीर उससे लड़ने के लिए लायक है, और आपको उसका सीरियस इफेक्ट नहीं होगा। माइनर इफेक्ट्स अभी भी हो सकती हैं, लेकिन आप अब भी जिनको वायरस का प्रोटेक्शन नहीं है, उनको आप वैक्सीनेशन लेने के बाद भी आप इसको आप फैला सकते हैं। इसलिए बहुत इंपॉर्टेंट हो जाता है कि आपको वैक्सीनेशन हो गया है, इसके बावजूद बहुत इंपॉर्टेंट है कि आप हमेशा मास्क पहने, सोशल डिस्टेंसिंग मेंटेन करें, ताकि औरों को वायरस आप नहीं दें। अभी तक जितनी वैक्सीनेशन की स्टडीज अब हो रही हैं, ये सब नई बातें हैं, सारी इंफॉर्मेशन अभी नहीं है। हमें ये नहीं मालूम है कि वायरस के वैक्सीन लेने के बाद भी हम कितने, हमारे इसको स्प्रेड करने में हमारी क्षमता कोई चेंज हुआ है या नहीं चेंज हुआ है। Are we spreading it as much as before or not? We are not sure. इसलिए वैक्सीन के बाद भी ये सारी प्रिकॉशंस लेने की बहुत इंपॉर्टेंट है। इसके बाद मैं कहा, इसलिए कि इसको कैसे, सोशल डिस्टेंसिंग मेजर्स क्या है, इसमें सबसे इंपॉर्टेंट बात है कि दूरी मेंटेन करना, कि औरों से नहीं मेंटेन, आप 2 मीटर अलग रहें, या आप किसी से कांटेक्ट आए तो एक सपोर्ट बबल गवर्नमेंट ने अलाउ किया कि ठीक है, आप अगर किसी एल्डरली लोग हैं या आपके छोटे बच्चे हैं, तो आप किसी एक ग्रुप के साथ आप कांटेक्ट, आप सपोर्ट के लिए, उनके सपोर्ट के लिए, एल्डरली लोग के या बच्चों के सपोर्ट के लिए उस घर के अलावे दूसरे घर के एक आदमी को, एक घराना को, के लोगों को अलाउ किया गवर्नमेंट ने कि ठीक है, आप उनको सपोर्ट करने, हेल्प करने के लिए आप उनसे मिल सकते हैं। वो उसके बारे में जानकारी दी गई। बहुत इंपॉर्टेंट बात है कि ये फैलता है अपने कॉन्टैक्ट, आपके बॉडी में सबसे ज्यादा आपके हाथों में आता है, क्योंकि आप हर जगह छूते हैं, आप डोर हैंडल छूते हैं, आप दरवाजा को छूते हैं, तो इसलिए हमेशा हाथ को बार साबुन से धोना, स्पेशली किसी जगह आप नए कमरे में गए, किसी नए घर में गए, नए ऑफिस में गए, हॉस्पिटल में गए, आपने दरवाजा खोला, आपने कोई हैंडल पकड़ी, तो आप जरूर अपना हैंड वॉश करें। और हैंड वॉश के बाद वो सैनिटाइजर का इंपॉर्टेंस है, आप सैनिटाइजर जो कि एक यूजुअली अल्कोहल बेस्ड होता है, ताकि वो जल्दी सूख जाता है, उसके चलते फिर जितना कोई वायरस आपके हाथ में है बचा है वो भी खत्म हो जाता है। उसका इंपॉर्टेंस कितना इंपॉर्टेंस है वो आप समझ सकते हैं। इसलिए इसी मुद्दे पे अपना फेस को मास्क पहनना, ताकि आपके नाक से या आपके मुंह से वायरस का लोगों को वो जो फैलता है वो कम हो, उसकी कितनी इंपॉर्टेंस है। अगर आपको खांसी आ रही है तो अगर आप मास्क पहने हुए तो आपका खांसी का वो उसी में रहता है। अगर आपको छींक आती है तो वो उससे आप उसको ज्यादा स्प्रेड करने से प्रोटेक्ट करते हैं। अगर आपके पास कहा जाता है कि अगर आपको छींक आ रही है, आपको और कोई जगह नहीं, आपके पास टिश्यू नहीं है, आपका मास्क नहीं पहने हैं, तो और नई जगह और मत फैलाइए, अपने एल्बो में अपने आपको इसको आप छींक लीजिए, ताकि आपको वो वायरस बाकी जगह नहीं, आपके एल्बो पर ही, आपकी बॉडी पर सीमित रहे और लोगों के पास कम जाए। और जो भी अगर आप टिश्यू यूज करते हैं अपने छींक में या खांस में, तो उसको हमेशा अच्छी तरह से उसको फेंक दें, सेफली फेंक दें, और अपना हाथ को जरूर वॉश कर लें फिर से। और ये भी कहा जाता है कि घर में वायरस अगर है तो अपना दिन में अपना खिड़की खुला रखें, ताकि हवा से, वेंटिलेशन से वो वायरस आपके घर से जल्दी बाहर निकल जाए। और सबसे इंपॉर्टेंट बात होती है कि आप अपने हाथ को ये हमेशा मान के चलिए कि आपका हाथ में वायरस का जरूर होगा, तो कोशिश कीजिए अगर आपने हाथ साफ नहीं किया है और आपने जेल नहीं लगाई है, तो अपने नाक को डायरेक्टली, अपने आंख को डायरेक्टली, अपने मुंह को डायरेक्टली हाथ नहीं लगाएं, क्योंकि आप अपने आप को ही खुद इन्फेक्ट करेंगे अगर आप प्रोटेक्टेड नहीं है, क्योंकि इस माध्यम, अपने हाथ के माध्यम से। इसलिए ये सब मेजर्स जो हैं वो हम सबों की रिस्पॉन्सिबिलिटी है। अगर हम सब समझेंगे कि ये वायरस का ये कितना डेंजरस है, इसके लिए हम कैसे क्या कर सकते हैं अपने लिए, औरों के लिए, ये सबको जानना हमारे हर आदमी के लिए बहुत जरूरी है। मैं इस बारे में मैं यहीं पर खत्म करूंगा। मैं इस पूरे कार्यक्रम के आयोजकों को, जो लोगों ने इसको अरेंज किया है, उसके लिए मैं बहुत आभारी हूं कि ये मौका दिया मुझे बोलने का, कि ये लोग समझे इसके बारे में। कोई और आपको सवाल है तो आप इसके बारे में इस प्रोग्राम के बाद में जरूर पूछें, हमने जहां तक कोशिश होगी हम इसका जवाब देंगे। धन्यवाद।
Thank you, Dr. Sinha. That was very informative. Now, Dr. Shah will now do the presentation. Now, Dr. Shah is a GP partner at West Heath Surgery. He has also been at the forefront of the vaccination program, and you may have seen him on the ITV News. The NHS, the surgery that he's working for, have also developed an NHS app, which has been now used. 80% of it practices in the Birmingham. He's Dr. Shah. He has a wife who is also a doctor and has 2 children. His mother is a committee member of Sri Lakshmi Narayan Mandir as well. So thank you very much, Dr. Shah, and I will hand you over. And in the meantime, Mr. Sinha, can you stop the sharing of the screen so we can continue? Thank you.
Thank you for that. And thank you to Arun for giving us such a comprehensive overview of COVID-19. And we know how serious it is in terms of the acute illness and the lasting after effects, not just physically, but also socially and psychologically. It's okay, so I'm just going to start my presentation. Okay, so from the earlier talk, it's very obvious why we need vaccinations. They provide immunity in a very safe manner so that you avoid contracting the disease in the first place. I mean, put simply, they are the most likely route back to some sort of normality. Now, COVID vaccinations have been developed at an unprecedented pace. In fact, pretty soon after WHO declared a pandemic just over a year ago, lots of vaccines went into development worldwide. Now, vaccines go through various trials and they go through different stages. So at this moment in time, in stage 1 trials, we have at least 77 in preclinical trials. So that's before they even get to phase 1 trials. Phase 1 trials look at safety of vaccines. So they're very, very small scale studies. They give it to a few people and they just make sure it's safe. So at the moment, there are 42 in phase 1 around the world. They then move on to phase 2, which are slightly larger scale safety trials. So they have deduced that it's safe from phase 1 and they go and give it to more people, to a wide variety of people. And again, they check it's safe. And there are 32 at the moment in phase 2. And then phase 3 is when they look at the effectiveness of the vaccine as well as the safety. And at the moment, there are 22 in phase 3. So there are lots of vaccines being developed. Now, at this moment in time, 12 have been authorized for partial or full use in various countries, and that's around the world. And they've all had emergency authorization because some of these vaccines are still in their phase 3 trials. Now, sorry, give me a second. What's happened here? Now, in the UK, 3 have been approved so far. So we've got 3 so far. So Pfizer-BioNTech was the first one, and that was approved on the 2nd of December 2020. And since then, we've also had the Oxford AstraZeneca approved at the end of December 2020, and Moderna on the 8th of January 2021. Now, the MRHA are also looking at Novavax, and they're also looking at Janssen, and they potentially could be approved later this year. The Janssen one is particularly interesting because it's a 1-dose regime, whereas all the others are 2-dose regimes. And the UK has ordered millions of doses of all these vaccines. So they've ordered 40 million doses of the Pfizer vaccine, 100 million of AstraZeneca, and 17 million of Moderna. Now, of these 2, the ones that are currently available in the UK are Pfizer-BioNTech and Oxford AstraZeneca. So I'm going to concentrate on these. The Moderna vaccine works very similarly to Pfizer, and the phase 3 trials showed similar effectiveness. So Pfizer-BioNTech, this is a really high-tech vaccine, and this type of vaccine has never been available before. It effectively uses something called messenger RNA, and they've encased this in lipids, and it's an extremely fragile vaccine. It has to be stored at -70 degrees. Once it's thawed, you've got 120 hours to use it, and it still has to be stored in the fridge. And once you take a vial out of the fridge, you've got 6 hours to use it. And it can't be moved from location to location. It's that fragile. I remember when we first got this vaccine and I was there with the vial and I was trying to mix it and I was literally going so slowly just because it's so fragile. So messenger RNA is in the vaccine. It enters your cells when you inject it, and then your cell uses that RNA to produce the spike protein for COVID-19. And then your immune system generates a response to that, and the messenger RNA degrades away. And then your body remembers how to fight that spike protein. You need 2 doses, at least 21 days apart, okay? And the initial phase 3 trial data was really, really good. It showed 95% effectiveness at preventing COVID-19. And this was the phase 3 trial data that Pfizer themselves produced. There is limitation in trial data. So subjects who are chosen for trials tend to be healthier, younger people, and they exclude certain groups such as pregnant people, people who are immunosuppressed. However, we've now started to get some real world data, and particularly from Israel. Why Israel? Because they've given more vaccine doses per head of population than any other country in the world. They've given about 106 doses per 100 people. So half of their adult population have had both doses of Pfizer. And only a few days ago, Pfizer published some more data. And what they found is 2 weeks after the second dose in Israel, it's been 95% effective at preventing symptoms, severe disease and death. And what's more interesting is that 80% of the cases they analyzed there were the UK variant, because that is now the dominant strain there. So it's 80% of those cases were the UK variant. There is some limited data against the South African and Brazil variant, but these are very, very early on. And what they found is that it is less effective against those strains, but still effective, but we don't have enough information to say how much. The other thing the Israel data has shown is that it's also 89% effective, they've said, at preventing asymptomatic transmission. So not only is it preventing disease, it's preventing transmission in a large number of people as well. That's very encouraging data. The Oxford AstraZeneca vaccine is a more traditional vaccine. So what they've done is they've taken a chimpanzee cold virus and they modified it to resemble coronavirus. And they then inject this into your body and it produces a spike protein. And then again, you produce a similar immune response to the Pfizer-BioNTech vaccine. This has advantages over the Pfizer vaccine in that you can store it at fridge temperature. It lasts for 6 months. It can be moved around, and again, when you open the vial, you've got 6 hours to use it in. So Oxford and AstraZeneca produced their trial data towards the end of last year, and what they basically showed was that it was about 70% effective, lower than Pfizer-BioNTech. However, there were no hospitalizations or deaths. There's also been some more recent data, actually, from 17,000 people who have had the vaccine in the UK, Brazil, and South Africa. And what it's actually shown is that it's 70% effective after 3 months of one dose and 82% after the second dose. And this is really important because that's the regime that we're following in the UK. And it also provides good protection against the UK variant. A preprint study in the Lancet, so this has not been published, has also shown that it reduces asymptomatic transmission by 67%. So it's also thought to reduce transmission of the virus to an extent. So and there's also some hospital data, and so this is on the government's own website. And what they're now finding for vaccinations in general is that the vaccinated groups, the death rate is falling much quicker. So the majority of over 65s have now had their vaccination. If you look on this graph, you can see from February onwards, the line is dropping a lot quicker than in the under 65s. And it's encouraging data all around. And you've got to put this in perspective. The best flu vaccine we have is about 40 to 60% effective. So these vaccines are very, very effective. In terms of the new variants, they can be easily modified. And both companies have said that if we need doses, particularly for the new variants, these should be ready by autumn. So the next question is, how safe are the vaccines? Well, the short answer is they're very safe. So in the Pfizer trial, there was very low incidence of serious side effects, and it's similar in both those who received the vaccine and those who received the placebo. So in the vaccine group, they had 0.6% incidence of side effects versus 0.3% in the placebo group. One of the things we have in the UK is something called yellow card reporting. So if we give a drug to someone and they report something that we think is an adverse event, we can fill out something called a yellow card and we can then submit it to the MRHA. So to the 28th of February 2021, bearing in mind we've given 24 million doses of these vaccines, there have been 33,000 yellow cards for Pfizer and 54,000 for AstraZeneca. That does not mean there have been 33,000 side effects and 54,000 side effects. That just means that people have submitted yellow cards because they think there may be a potential adverse effect. And the vast majority of these are for injection site effects, like a sore arm or mild flu-like symptoms. Severe allergic reactions are very, very rare. We've been vaccinating ourselves in our hub since the middle of December. We've given thousands of vaccinations. We've not had a single anaphylactic reaction, including in people with a history of anaphylaxis. We've probably submitted a handful of yellow cards, and even then, we're not sure if that's anything to do with the vaccine or was it just a coincidence. The second question is, have they been rushed? Now, we can all agree this has been at breakneck speed, but the actual development phase has not been rushed, and this is a once-in-a-generation pandemic. The main reason vaccines take so long to develop is funding. It can take years to get actual funding. There has never been a period such as this where so much funding from so many governments has been pumped into vaccine production. They've got a vested interest in making these vaccines work. Necessity is the mother of invention. In the trials, they've had large numbers of people. So the Pfizer-BioNTech trial, they had 43,000 people in 6 countries. The AstraZeneca trial, they had 20,000 participants. When a disease is this prevalent, it's actually easier to find volunteers to take part and have data that demonstrates effectiveness. The more successfully you suppress a disease, the harder it is to actually find number of participants and get meaningful data. So yes, the entire timeline has been sped up, but they've still gone through all the necessary phases that you would want them to go through before the vaccines have come to market. The only thing that is slightly different is the emergency authorization that the UK government have given to approve them. And there's been some stuff in the media in the last few days about blood clots, and 2 or 3 countries have suspended use of the AstraZeneca vaccine because they're worried about blood clots. To put this into perspective, 11 million doses have been given of the AstraZeneca vaccine in the UK, and there has been no more incidents of blood clots than would be expected anyway. In the UK, your chance of having a blood clot is about 1 in 1,000, whether you have a vaccine or not. The European Meds Agency have also reported that 5 million doses have been given in Europe, and they've had 30 people who've had blood clots, and they again said that that is no more than you would normally expect. And you don't know if these people had underlying health issues that increase their clot risk anyway. But do you know what does increase your clot risk? Severe COVID. So severe COVID is associated with blood clots. And one study in an ICU, they took 184 people in that ICU, and 31% of those patients had blood clots secondary to COVID-19. So should you get one? Yes, if you're eligible for one. It disproportionately affects ethnic minorities. We've all seen the data for that. And I think what we've also found is that for whatever reason, in certain communities, the uptake has not been particularly high. And those are the communities that are disproportionately affected. So we do need to get the message out that this is a safe and effective vaccine. And if you're eligible for one, you should get one. The other thing to bear in mind is that if we don't get this under control, there are going to be risks of further outbreaks. Mutations can happen, and mutations happen when a virus is endemic in a community, and the virus will then look for ways to evolve. So the only way to reduce that risk of further mutations is by suppressing it as much as possible. The other thing to bear in mind is the vaccine takes a few weeks to work. So the quicker more people are vaccinated, the better. No vaccine is 100%. You're still going to get cases of COVID afterwards. It takes 2 to 3 weeks for this to work. We anecdotally have had cases where people have had the vaccine, then developed COVID a week later, and I think that's because they assumed that the vaccine was going to work from day one. It doesn't. The other thing I just want to bring up here as well is lateral flow tests, because I know a few people have mentioned those. So lateral flow tests are being used quite a lot in the community now, and they do have their uses, but you've got to bear in mind that a negative lateral flow test does not mean you have not got COVID. They are about 60 to 70% accurate for a negative test. If it's a positive lateral flow test, then it's highly likely you do have COVID, and then you should follow the current guidance, whether that involves getting a PCR test. And they should not be used if you have symptoms that are consistent with COVID. You should then get a proper PCR test. Okay. So basically, the vaccine program has been extremely successful in the UK. We are very lucky that we are in the UK. I think we are one of the countries that are shining light in the vaccination program when you compare it to other countries. And also it's free at the point of delivery, which is also not the case in every other country. I'll give you an example. In the US, they've said the vaccine is free, but a physician there can still charge you to deliver the vaccine, so it's not completely free. So we're extremely lucky here, and I think if you're offered a vaccine and you're eligible for one, you should really, really consider having it. Thank you very much.
Okay, thank you, Dr. Shah. That was a really, really informative, actually. We now have Jitesh Bhai Samani, who is an IT consultant. He's Secretary of Lahana Association, Birmingham, President of Birmingham Handsworth Lions Club, and also involved in community service in helping Hindu organizations. He will take any questions you may have. Please post these on Zoom chat or comment on Facebook. Over to you, Jitesh Bhai.
Hi there. Thank you for the introduction, Sangeeta Ben, and brilliant presentations, Mr. Sinha and Dr. Shah. We have some very good questions covering both the virus and the vaccine. So let me start off with the first question. The first question says, I had my vaccine yesterday. I'm feeling hot and cold during night and have cramps in my knee. Are these type of side effects normal? What are typically known side effects of taking the vaccines? Maybe Dr. Shah?
Okay, so in terms of that specific individual, my advice would be that I can't comment on the circumstances. They need to seek advice from NHS 111 or out of hours or their own GP, because I can't give that specific advice. So general side effects that have been seen after the vaccines are common vaccine side effects. So sore arm, feeling a little bit flu-like for 2 to 3 days, mild fever, muscle aches, headache, feeling a little bit tired. But generally they should be very mild and should only last 2 to 3 days. And if they are not mild and they are lasting longer than that, or you're worried that you are having something that is not a common side effect, you should seek help from a medical professional.
Thank you. So the next question is still on the vaccine. Can the vaccine be mixed between the first and second dose? If I took AstraZeneca for the first dose, could I take Pfizer for the second dose?
So the current advice is to have the same second dose of whichever first dose you had. And the reason for that is because all the trial data looks at same dose regimes. There are some trials that are now going on looking at mixed dose regimes, but that data hasn't been published. So the government advice is you should always endeavour to have the same first dose and second dose. They have said in exceptional circumstances that may not be possible, but then you should always discuss that with your physician, GP, whoever it is, to make an informed decision about that at that time. So the bottom line is you should not mix at this moment in time.
Okay, thank you. The next question, still staying on the vaccine. If at the time of being called for the vaccine and they attend the surgery or the center where they're having the vaccine, they are COVID positive, but they might not be aware that they're COVID positive, will the vaccine still work? And is it advisable to have something like a lateral flow test before taking the vaccine?
Okay, so it's a good question, actually. So should the vaccine still work? Theoretically, yes, it should work to an extent. Now, how much, we don't know. What I will say is the current guidance is that if you have symptoms of COVID or you've had a positive COVID test in the last 28 days, you should not attend for a vaccine. So if you have symptoms of COVID, you should get a PCR test and isolate and follow the instructions. If you have had a positive COVID test, then you should wait 28 days. And that's purely because if you then do get any vaccine after effects, you're not going to know if that's actually a COVID after effect or is it a vaccine after effect. What they're doing in some countries actually is they're actually saying that if you've had COVID in the last 3 months, positive COVID, then you only need 1 shot of the vaccine because you already have some immunity from COVID. Now, that's not the UK guidance. I think in certain countries like the US, they are now giving that as guidance, and that may change here in the UK as well because you do have some residual immunity. With regards to lateral flow tests, as I've already said, a negative lateral flow test does not mean you have COVID. The current guidance is, so they're not that useful. If you're going to attend for a COVID vaccination, the main thing you've got to look for is symptoms or have you had a positive exposure in the last 10 days. If it's either of those things, you should not attend if you've been asked to isolate by test and trace.
Okay. This next question is more around the virus and the treatment of critical patients. So either of yourself, Dr. Shah, Mr. Sinha. In India, critical COVID patients are administered plasma therapy and remdesivir. What is the treatment plans for critical patients in the UK as it's not widely publicized? What happens?
I can only make a start to and I would like Ajay to take over to say, Jen, look, once the patient is admitted to a hospital, the treatment has to be tailored to the need of that patient. One cannot generalize that statement as to what will happen to this group of patients in India. I mean, that is going to be decided by the treating physician. On this forum, it's very difficult to give that kind of make that kind of a state for anybody to give a specific answer as to what is the treatment should be given in an acute stage. That's a specialist job.
Okay. Thank you.
Ajay, would like to add
anything? I haven't got much more to add. I can only agree with everything you said. I mean, I've got no experience of COVID treatment in hospitals at all. I've not experienced that at all because I'm a general practitioner in the community. So I wouldn't be able to answer that question at all. I don't have the information. But as you said, it has to be individually tailored to that patient.
Sure. Thank you. Mr. Sinha, in your presentation, you talked about transmission, and two things that are mentioned are symptomatic and asymptomatic. Not many people understand what these two terms mean. Could you explain those?
As I was saying earlier in Hindi, maybe I didn't come across very clear. A lot of us are maybe carriers, where the virus is there in our cells, in our hand, in our bodies, or in our surface of our bodies, and we do not know about it. We may be having very mild symptoms of feeling a bit of cold-like symptoms, a bit snuffly, not very ill, not ill at all. So for all practical purposes, we appear to be normal. Don't have any symptom. So that's the reason what we mean that you're asymptomatic, but you're still a carrier. Whereas symptomatic is where our two types are mild and severe. When we are mild symptomatics are people who've got a cold-like problems, snuffly, a bit of a temperature, you're just having a congested nose, but not excessively that you're too ill with it. So that is a common cold-like symptom that you get. That's one of the milder ones there.
Mm-hmm. Thank you. Staying with you, Mr. Sinha, you mentioned in your presentation that we have the South African variant, the Brazilian variant. So is it normal for this virus or any virus to mutate like this regularly? And if it does, what is the impact on the vaccinations we have now?
Yes, again, it's a very good question. As Ajay also referred to, the viruses, this is the nature of this virus is to mutate because it's expanding, it is expanding so quickly. In that process, when it is dividing so quickly, so rapidly, there's always it's a natural process that the combination of the proteins that they are reforming every time, that can change. And that's how these variants, they have a different identity. So this happens more if it happens over time. How many months and years or weeks it has been, depending on that inherent the quality of that particular virus, that how that fast it divides, that it has a chance of mutation. And therefore, we are only talking about these 3 mutations so far. There can be more in future.
Okay.
Can I just add to that? So yeah, thanks. So with mutations, I mean, all viruses mutate. That's why we have to have a flu vaccination every year, because the flu virus mutates slightly. And COVID has probably gone through thousands of mutations, and the majority of those mutations will not change the virus. In fact, the Italian version of COVID that hit Italy last year was different to the original Chinese version in Wuhan. There were slight differences. And what generally happens is viruses mutate and they become less they become less deadly over time with those mutations. So the reason we're concentrating on these 3 mutations is because they've given an evolutionary advantage, i.e. they're thought to be more transmissible, but viruses mutate all the time. And the advantage of these vaccinations, and particularly the messenger RNA ones, like Pfizer-BioNTech, is they can be very, very quickly tweaked to combat those mutations. And as I've said, both companies have come out and said that it's a matter of months if needed. But the other key thing to bear in mind is at the moment, they are not the dominant strains in the UK. The dominant strain is the UK variant, and both of those vaccines have good effectiveness against the UK variant. And to prevent mutations, the most important thing is getting transmission of the virus down by following all the rules and getting vaccinated. If the virus isn't there, it cannot mutate.
Thank you. 2 excellent answers. Thank you very much. Is it safe for a woman planning to have children to take the vaccine? I mean, can the vaccine affect fertility or the chances of getting pregnant?
Okay, so in the trials, there weren't any pregnant women. However, if you're planning to have a baby, the current UK advice is that if you're eligible for a vaccine, it is okay to have the vaccine. Compared to similar viruses that we do give in pregnancy or other viruses that we have available, this is not a live virus. There is no reason it should affect fertility or pregnancy. If you are actually pregnant, though, then you should discuss your individual circumstance with your health practitioner. I've given it to a few pregnant women, but that's after a very detailed discussion with that woman. And I know their circumstances, and it may not apply to everyone, actually. So you've got to balance the risk versus the benefits. If you have the first dose and then become pregnant, then what you should do is discuss the second dose with your health physician, your obstetrician, because again, they would have to carry out risk assessments as to whether or not you should have the second dose during pregnancy or should it be delayed. And again, that has to be an individual decision. So the bottom line is if you're planning to become pregnant and you're offered the vaccine, it is fine to have it. If you then become pregnant or you are pregnant at the time of having the vaccine, you should discuss it with the relevant people to make sure you're making an informed choice.
Thank you. Excellent answer. Staying with you, Dr. Shah, in your presentation, you talked about efficacy and effectiveness. What's the difference? What do you mean?
They're the same, they're interchangeable actually. Okay, so what they did was in the trial, they looked at, so they have two groups. They have a treatment group and a placebo group, and the treatment group get the vaccine, the placebo group don't get the vaccine, and each group does not know what they're getting. And what they would then do is follow those people and look at the number of COVID cases in the treatment group versus the placebo group. And that's how they come up with that 95% effectiveness, because they found that the number of people who had COVID in the treatment group was 5% of the number that had it in the placebo group, hence the 95% effectiveness.
Okay, and that's a great answer. And just staying on this vaccine, so we have a first dose followed by a second dose in 12 weeks. Is this likely to be an annual thing or every 6 months? How is the vaccine going to, is there going to be a need for the vaccine on a regular term?
No one knows the answer to that, is the answer to your question. I mean, if you look at other coronaviruses, their immunity does not last. That's why you can get a cold more than once. A cold is a coronavirus as well. Now, whether or not this particular coronavirus behaves exactly the same, we do not know as yet. What they found in studies of people who've had COVID is that antibodies that they have from the original COVID infection can reduce over time, and I think they're saying that on average they will have them for about 6 months. Now the vaccine should give you a much stronger antibody response than that, because you're giving everyone a targeted response by giving them the vaccine, whereas with COVID it very much depends on the severity of the COVID at the time as to your immune response to it. So you will we don't know the answer, but there's a potential for this to become an annual or a biannual vaccine, but it's too early to tell at the moment.
Okay. We just had a question come out. Does 12 weeks gap between first dose and second dose change the efficacy of the vaccination?
So as I said in my presentation, the Oxford AstraZeneca vaccine does have some data to suggest that the longer gap actually improves its effectiveness, and actually don't lose anything by having a longer gap as opposed to the 28-day gap. So the government's theory is that the more people that can have a first dose, the more people have some protection. So they're estimating 70 to 80%, and then the booster dose will increase that slightly more and possibly for longer as well. Okay, Pfizer theoretically should do the same, but there is no data to back that up at the moment. And Pfizer have quite clearly said that they are sticking by their dosing regime because that's what they used in the trials. But theoretically it should work, and that's what the government has speculated on. Now they've got a lot more information than I have. They've got scientific advice that I probably don't have, I'm not privy to. So that's why they've gone with that. And you've got to think that they would be using all the information they have available at the time to make the best decision for the public.
Mm-hmm. Thank you. And final two questions. So I've heard that the vaccine can change my DNA, so I'm scared of taking it. Is that true?
Yeah, so when I got it, I developed the power of flight 2 days later, and I was very happy with that. No, it's not true at all. I mean, there's lots of things going around on Facebook about how you can alter your DNA, and I'm sitting here talking to you, and I've had the Pfizer vaccine. All my staff have had it. I've vaccinated countless patients, and no, it doesn't at all.
Okay, thank you. And the final question, maybe Mr. Sinha may want to answer. I hear a lot in the news about the R number, this reproductive number. What is this? What does it mean?
Oh, I think I'll leave that to Ajay to answer. He's a specialist on that.
So the R number, okay, so in simple terms, the R number is it measures the speed at which a infection reproduces in the population. So if the R number is 1, that means every 10 people will infect 10 people. So you infect the same number of people that have originally got it. So one person will infect one more. If the R number is 2, it means one person will infect 2 people. So it's doubling. If the R number is 3, one person infects 3 people and so forth. So it means the infection is growing. So the R number, if it's below 1, it means one person will infect less than one person. So extrapolating that further, If the R number is 0.7, that means 10 people will infect 7 people, and so forth and so forth. So the epidemic will shrink. So that's what the R number means. It's a ratio, it's a measure of whether it's shrinking or not. And the important thing to understand is above 1 means it's growing, and the further above 1, the faster it's growing. I think last March, when it first hit, they estimated the R number was around 3. And if it's below 1, it means that the epidemic is shrinking because all the people are infecting less people each time.
So how do we keep the R number below 1?
By following all the advice in Arun Bhai's presentation. You've got, I think it's really important. So asymptomatic transmission is where this comes in. The reason this coronavirus has spread so much is because of asymptomatic transmission. If you compare it to SARS, the original SARS in China, in Hong Kong 10 years ago, it was very obvious when someone had an infection. They were very symptomatic. There was very little transmission before you showed symptoms, so that could be stopped in its tracks. The problem with this coronavirus is that a lot of people are infected for a couple of days before they even have symptoms, and a lot of people don't even have those symptoms and they spread it. And that's why social distancing and following all the measures is so important. You've got to assume you've got the virus. I've been vaccinated, my staff have been vaccinated. We still follow all the same protocols in our surgery, as I'm sure Arun Bhai does in his work. It does not change because you cannot assume that you're not carrying it. You've got to assume that you are.
Brilliant. Thank you very much. I mean, that's all the questions for now. Some brilliant answers by yourselves, Dr. Shah and Mr. Sinha. I'll hand back to Sangeeta Ben.
Thank you, Jitesh Bhai. We now have Dinesh Bhai Chauhan. He's a senior trustee for Lakshmi Narayan Mandir. He has been dealing with a project regarding COVID-19, and he's currently handling and coordinating the COVID-19 project with Birmingham City Council and Birmingham Health Department. So I'll now hand over to Dinesh Bhai to explain a bit more.
Thank you. Can you hear me?
Yes, we can. Yes.
Okay. Thank you very much. First of all, I'm so grateful on behalf of Sri Hindu Community Center and all the congregation to Dr. Arun Sinha and Dr. Ajay Shah, Sri Jitesh Bhai Samani, who is the IT consultant and a very public figure, Sangeeta Ben, who is our secretary of Sri Hindu Community Center, and of course, the person who is behind the scene dealing with all the technicalities of this particular presentation, our key worker, Tejas Sangvi. Now, I'm grateful to Birmingham City Council, and this presentation today has been brought to you in conjunction with Sri Gita Bhavan Temple and under the auspices of Birmingham City Council. Now, the most important thing, what one of the questions asked was, the reason why we have been doing this is to bring some sort of an awareness within the community and to bring the information to the community members regarding COVID-19. All the experts have given their opinion. It is our duty to our community members to give as much information as we possibly can, being a place of worship. Sri Hindu Community Center has been dealing with this project for quite some time now. And what we intend to do is to carry out a vaccination program. And hopefully, we may be able to do the vaccination program on 21st of March, which is next Sunday. And that will be done under the auspices of Dr. Ajay Shah and his team. We will inform you as soon as it's practically possible to say at what time. I have been advised, and perhaps this advice may change, or Dr. Ajay Shah can have a little bit of input into it. At the moment, it will be targeted to people over 50 and anybody over 18 who is multi-generational and living in the same family. Perhaps Dr. Ajay Shah can throw more light into it so that we are very clear-cut to the people who are listening on this seminar. And finally, before taking too much of a time, please stay on. We have got a short, small video for you to see. And without taking too much of your time, I would like to thank everybody for their time and effort in attending this particular seminar. I hope you have found it useful, and we'll do our level best to keep you informed and bring the awareness. Thank you.
Thank you. So we are hoping to hold it next Sunday at the Warwick Road Mandir. It's open to anyone who's over the age of 50 who has not had a first dose of vaccination. So we cannot do second doses of vaccinations. So it's first dose vaccinations only. If the only exclusions would be if you are currently pregnant or you've been informed by your health practitioner that you should not have the vaccine for any reason. And we have also been given the green light to vaccinate any members of that household who are above the age of 18, but they must be living at the same address, and this must be evident on the NHS spine when we put their data in. So for example, if there's a 55-year-old and their 18-year-old son or 20-year-old son lives with them, we could vaccinate both members of that family. So I think Dinesh Bhai is going to send out more details of how people can show their interest in this program. And then once we have the green light and we know it's feasible, we will let everyone know the timings.
We can go to the video now.
आपको कोविड-19 टीकाकरण मिलने वाला है या हाल ही में मिला है? इस छोटे से वीडियो में महत्वपूर्ण जानकारी दी गई है, तो कृपया इसे अंत तक देखें। यह टीका गंभीर बीमारी की रोकथाम कर सकता है, लेकिन इस टीके से मिलने वाली सुरक्षा के प्रभावी होने में 2 से 3 हफ्ते लग सकते हैं। टीका लगवा लेने का यह अर्थ नहीं है कि आप पूरी तरह से सुरक्षित हैं। जब बुलाया जाए तो दूसरी खुराक के लिए आपका वापस आना बेहद महत्वपूर्ण है। इससे आपको सुरक्षा का उच्चतर स्तर हासिल होगा। इस टीके की दोनों खुराक लेने के बावजूद आपसे किसी और को कोविड-19 का संक्रमण हो सकता है। टीकाकरण हो जाने के बाद भी आपको खुद व अपने आसपास के लोगों की सुरक्षा के लिए निम्नलिखित सरल चीजों को करना जारी रखना चाहिए। काम पर जाने, चिकित्सक से मिलने, व्यायाम करने या जरूरी चीजों को लाने के अलावा आपको घर पर बने रहना चाहिए। सामाजिक दूरी बनाए रखने के सभी नियमों का पालन जारी रखना चाहिए। आपस में 2 मीटर की दूरी बनाए रखें और घनी सार्वजनिक जगहों पर मास्क हमेशा पहने रहें। अपने हाथों को नियमित रूप से कम 20 सेकंड तक कायदे से धोएं। सतहों को नियमित रूप से साफ करते रहें व भीतरी स्थानों का वातायन यथासंभव बनाए रखें। हमें पता है कि यह करना कठिन है, लेकिन अपने सुरक्षा कवच को ढीला ना पड़ने दें। जब तक कि हम लाखों और लोगों को टीकाकरण प्रदान करके संक्रमण स्तरों को काफी नीचे नहीं ले आते हैं, हम सभी को एक दूसरे को सुरक्षित रखने के व्यवहारों का पालन करना जारी रखना चाहिए। आपके एक्शन मायने